Orders of the day.
Ballot item number 20, Order M54, second reading of Bill 54, an act to amend the Home Care and Community Services Act 1994 in respect of funded services for new residents. Mrs. Gretzky.
Member from Windsor West.
Thank you, Speaker. I move second reading of Bill 54, an act to amend the Home Care and Community Services Act 1994 in respect of funded services for new residents.
Mrs. Gretzky has moved second reading of Bill 54, an act to amend the Home Care and Community Service Act 1994 in respect of funded services for new residents. Pursuant to Standing Order 98, the member has 12 minutes for her presentation. The member from Windsor West.
Thank you, Speaker. It's my pleasure to rise today on behalf of my constituents of Windsor West and speak to my private member's bill, Bill 54, titled Dan's Law, after Dan Duma, a gentleman who personally, along with his family, experienced the issues my bill aims to address. If passed, this legislation would amend the Home Care and Community Service Amendment Act, close the gaps to home and community care. Speaker, I'd like to point out from the beginning that this bill has the support of the Ontario Medical Association, the Ontario Nurses Association, Hospice Palliative Care Ontario, Home Care Ontario, and CUPE Ontario, who represent thousands of healthcare workers. Joining us at Queen's Park for the debate today on Dan's Law are Dr. Darren Cargill, the palliative care leader for the Erie St. Clair Regional Cancer Program, and Dr. Cargill was also Dan Duma's palliative care doctor. Also joining us are Anna, Dan Duma's wife, and Laura Duma, the daughter of Dan Duma. I will be sharing Dan's story this afternoon, as well as that of what his family experienced during a very difficult time for them all. And I'd like to thank them all for being with us here today to watch the debate on my bill that is named after someone that is so special to them. And I think that's important to point out, that the people that have come today, Dan's family members and his doctor, have traveled a great distance. Some have come from Windsor and some have come from as far away as Alberta, because that's how important it is to them. Under the current law and the interprovincial billing agreement, residents of any Canadian province or territory that move to Ontario must apply for provincial health care coverage in Ontario, or, as we know it, OHIP, and complete a 3-month waiting period before health care that is not deemed medically necessary is covered. This means that they can access physician and in-hospital care, but do not qualify for home or community care. This is the healthcare gap that Dan Duma and his family was caught in. And Speaker, I'm going to take some time to speak about the man that this bill was named after, and some of the obstacles that him and his family faced. And although it's the ending is sad, because Dan is no longer with his family. They're here now. Okay. There's an opportunity for a happy ending for other people. Dan was an auto worker at General Motors in Windsor, for many years. When General Motors closed, not only were several people put out of work, but several had to leave our province to go find employment. Dan and his wife Anna left their 2 daughters behind and moved to Fort McMurray for Dan to find stable employment. While in Alberta, Dan was diagnosed with liver cancer. In May, he was admitted to a hospital in Fort McMurray with some complications. At the height of the forest fires, so when they had the forest fires that were ravaging Fort McMurray in Alberta this year, Dan had to be evacuated to Edmonton, and his wife Anna joined him. Unfortunately, because they don't have a home in Edmonton, Anna had to take up residence in a hotel. While Dan was in Edmonton, he was told that he was not going to survive his illness, and he had basically two choices, because him and his wife could not return to their home in Fort McMurray because of the fires. He could either live out his final days in a hotel room with his wife, or he could return to Windsor, his real hometown, and be with his children. When Dan moved back to Windsor, his family assumed, like most of us in this chamber and most of us in this province and this country, assumed that because we have universal health care, that meant that Dan was going to have full access to all the health care services that he needs. Unfortunately, they found out that that's not the case. If Dan was in hospital, he would receive all the healthcare services that he needed for his end-of-life care, and that would be covered under the reciprocal billing agreement between provinces. And as we know, not only has the province recognized, the province of Ontario recognized, the government recognized, but everyone in the healthcare sector has recognized the importance of people who are facing end-of-life care having the option to live their final days in the comfort of their home, surrounded by those that love them, and have the opportunity to die with dignity. They shouldn't be faced with having to die in a hospital. That's not where anybody wants to be. And the government side has also recognized the importance, the financial importance of people having an opportunity to choose where it is they want to face their final days. Dan didn't have 3 months to wait for his OHIP coverage to come into effect. Dan passed away on July 18th, just 1 month into his 3-month waiting period for care here in Ontario. And Speaker, this isn't about the quality of care that somebody is receiving. We know that the healthcare professionals in our hospitals do the very best that they can every day with the resources that they are given. So this is not about necessarily the quality of care that somebody is going to receive. It's about where they're going to receive that quality of care. And I'm going to talk about the fact that during many interviews that I've done on this issue, there's been a lot of interest in this issue. I've had many media outlets reach out to me. As I said, there's many organizations, professional organizations who have contacted me and are in support of this bill. Many private citizens, not only in Ontario but in other provinces, that have reached out to me in support of this, because I think everybody, like them, recognizes the importance of what it is that the Dumas have faced and how we would all feel if it was one of our family members or ourselves who had to move to another province for work and found out that we were facing the end of our lives and we wanted to be back home with our family. So I think that's something that we can all relate to. But there is a gap that needs to be addressed, and I know the minister, I believe, the Minister of Health had acknowledged that he's interested in engaging in conversations with other provinces and looking at filling this gap. But we have an opportunity as a province to be the leaders when it comes to home care and hospice care. We have the opportunity to say to other provinces, when you enter into those talks, that we've already done it. We've already said you're welcome to come and be with your loved ones. We understand the importance of you receiving care at home or in hospice, if that is the best setting, and that we're addressing that. We're providing that care to people. We're providing that choice without a financial burden. We're providing that access, and that we've set the examples, and we want the other provinces to follow our lead. And I believe that by supporting my bill, we'll set that example, and that'll move those talks along faster. And what we'll see, hopefully, is an end very quickly to people who have the same story as Dan. One more story like Dan's is one too many. Dan's story should not have to be told. Dan should have been provided the care that he deserved in a place where he wanted to be, surrounded by the people he wanted to be surrounded by. And my hope is that this bill will address that. It will have support from all sides, that it won't just go to committee. It will actually be called before committee so that we can have those discussions, that it'll come back to this House and it will become law, and that'll happen quickly. Like I said, nobody in this country should have to go through what Dan and his family did. It's all too common that we have people who have to move out of province, not just in Ontario, other provinces have it too, where people have to move out of province for work. They don't have a choice. They shouldn't be limited to their ability to return home to be with their loved ones in their final moment. And as I had said, Dan didn't have 3 months. Many people don't have 3 months to wait for health coverage. And I just want it to be clear, because that's something that came up during many of the conversations that I had too. I just want to be clear on what the bill addresses. The 3-month waiting period would still apply for all other healthcare services that weren't deemed medically necessary. This bill only addresses home care and palliative care in a hospice. Those are the people that we are looking to help with this bill. And I know that's not fixing the entire system, the entire healthcare system, and I know there's work to be done with other provinces, but I just want it to be clear because some people were a little confused. All this is addressing is those people who need home care or palliative care in a hospice. It would eliminate that 3-month waiting period. They would still have to apply for OHIP coverage for anything above and beyond that wasn't already covered under the interprovincial billing model. As I said, Speaker, we have an opportunity to be the leader on this, and I think that if we do take the lead on this and we set the example for other provinces, you'll find that they come on board and they do what's right as well. And it's something that maybe we don't want to talk about when we're talking about a story like Dan's, because Dan's story is important, and that's really what people want to hear. But another question I had been asked about was the cost. What would the cost be of passing this law and providing the care that I'm asking for? And Speaker, as the Minister of Health probably well knows, the cost of care in hospital far exceeds the cost of home care. In fact, the numbers that I've been given is the average hospital stay, and now this will vary depending on the needs of the patient, clearly. The average cost of a hospital stay is $1,000 a day. The number that I've been given for home care, again an average, is $100 a day. So what I'm hoping is that if you want to look at it, not just from the compassionate side of things, because we do need to look at it from the compassionate side of things, but if you want to look at it from a financial side of things, look at the cost. Look at the fact that for someone to be in hospital for end-of-life care, the average cost is 10 times more than to grant them their wish to die at home, in the comfort of their home, with dignity, and surrounded by their family and friends, the place they want to be and the place the government has recognized they should be. Thank you, Speaker.